Hello friends, today we are going to talk about a very common but often confusing condition called Irritable Bowel Syndrome or IBS. Repeated abdominal pain, gas, constipation or loose stools. If these symptoms keep occurring, IBS could be the reason. In this video, we will understand what IBS is, its symptoms, how it is differentiated from the similar diseases, and its mechanism, risk factors and treatment. So, what is IBS? IBS, Irritable Bowel Syndrome, is a functional gastrointestinal disorder. This means that the structure of the intestine is normal, but its functioning is abnormal. In IBS, the intestine becomes very overly sensitive and bowel movements becomes irregular. It is not an infection, cancer or ulcer, but it can be significantly affect a person's quality of life. So, symptoms of the IBS are recurrent abdominal pain or cramping, gas and bloating, constipation, diarrhea, alternating constipation and diarrhea that is of the mixed type, feeling of incomplete bowel evacuation. Symptoms worsen during the stress. An important point is that symptoms usually do not wake the patient from sleep at night. IBS can be differentiated from the other similar diseases like the IBD, the Crohn's disease or ulcerative disease. In IBS, there is no inflammation, whereas in IBD, there is actual inflammation and ulceration of the intestine. IBD commonly presents with weight loss, blood in the stool, and anemia, which are not typical of IBS. IBS can be differentiated with the lactose intolerance. Lactose intolerance is specifically related to the milk and dairy products, whereas IBS can be triggered by multiple type of foods. It is also differentiated by the celiac disease. Celiac disease is an autoimmune disorder triggered by gluten. In IBS, there is no autoimmune damage to the intestine. So now understand what is the mechanism of the IBS. How does the IBS occur? Abdominal pain and visceral hypersensitivity. In IBS, the intestine becomes extra sensitive. Even normal amount of gas or stool can cause significant pain. This is known as the visceral hypersensitivity. Disturbed bowel motility. Sometimes the intestine moves too fast, leading to the diarrhea, and sometimes it moves very slowly, too slowly causing the constipation. So there is also the role of carbohydrates, the FODMAPs. Some carbohydrates are poorly digested, such as short chain fructose, lactose, sugar, alcohols. These reach the intestine and get fermented, producing gas and drawing water into the bowel, leading to bloating, abdominal pain, and diarrhea. That is why low FODMAP diet is helpful in IBS. So, stress, anxiety, and depression can also worsen the IBS symptoms. The connection between the brain and the gut is known as the gut-brain axis. Now we can see what are the risk factors of the IBS. Risk factors for the IBS include high level of stress or anxiety, female gender, family history of IBS, previous intestinal infection, irregular eating habits, sedentary lifestyle, poor sleep. So, treatment of the IBS it is individually based and symptom based. So dietary modification, low FODMAP diet, avoid dairy if lactose intolerance, reduce spicy fried foods, lifestyle changes, regular physical activity, stress management technique, adequate sleep. And in the medications, we can give antispasmodics for the abdominal pain, fiber supplements for the constipation, diarrheal agents for the diarrhea, and probiotics to improve the gut health. And psychological therapy also is important. In severe cases, cognitive behavioral therapy, CBT therapy, and relaxation technique can be very effective. So friends, IBS is not life-threatening disease, but if ignored, it can significantly affect daily life. With proper diet, stress control, and medical guidance, IBS can be effectively managed. If you found this video helpful, Please like, share and subscribe. See you in next video. Thank you.